So this is what we found, that of the doctors, of the 400 that we interviewed, and we stopped at 12 waves. We probably could have gone a bit further than that. 43 had arrived in 2006, and in 61% of departures, people were associated with some violent event. So right away we can see this is probably not a completely representative sample, but it might be. Then we found that 75% of households had experienced some violent event. We have more details than that, but that's basically it. 39% had immediate household members still in Iraq, so a lot of people still had family there, and that turned out to be a draw factor. People who thought about returning were more likely to be people who had relatives still in Iraq. And older doctors, specialists, and those first internally displaced were more likely to have violent events associated in various ways, kidnappings and so forth. And so this is what we could calculate as far as rates. So these are the rates of violent events among doctors, and this is a doctor's experience with their own facilities. So we recorded no data in times that people were not actually part of a specific health system. So starting in 2003, violent events were about 10 per thousand per year. These are violent deaths, and for the specific facility. So in 2006, this peaked at about 47 violent deaths per thousand per year. So it was a fairly substantial number. And these were the number of these were the doctors in Baghdad. And the majority of people came from Baghdad, although a large number, a substantial number of people reported they had moved to Baghdad from someplace else a year or 6 months before, and often in preparation for moving on outside the country. If we looked at the non-Baghdad doctors, interestingly enough, the level was higher in 2003. And that was of interest to us because in our first assessment of mortality in Iraq, we found that violence outside of Baghdad was greater than that inside Baghdad. So that looks at deaths among violent deaths. We looked at kidnappings. Get a picture like this. This is people in Baghdad. This is people outside of Baghdad. Very interesting. I have no explanation for why we had this big peak reported in 2005 for outside Baghdad. These numbers are fairly small, so we have to keep that in mind. And then we looked at violent injuries of various sorts. This is the number in Baghdad. This is the number outside of Baghdad. And then we looked at issues of migration, which is another area of interest. And these were the numbers for Baghdad, the rate of departures per thousand per year. Again, peaking at 2006. This is a general pattern of all refugees who left the country, both to Jordan and to Syria, all peaked in this particular year. And these are people here, this dotted line, are people who've moved within Baghdad, who've gone someplace else. And so that pattern is much less, but it follows the same general direction. Then we looked at, then we looked at doctors outside of Baghdad who moved, and there the pattern was a bit mixed from year to year. And then we asked people about the health system. How is the health system functioning where you were in the various years? So we asked about the number of positions that were filled. And so this is the response. And this is the kind of the 50% line. So for 2003, half of doctors said, well, at least 90% of the facilities were filled at that time. And then by the time we get to 2006, we're looking at about 30% of the establishment being filled, half of the doctors responding. Some of them from facilities where there were more people filled than that, but this was the 50% line. And then we asked about availability of functioning equipment. Did you have it rarely? Did you have it sometimes? Was it almost always functioning, or often functioning, or was it almost always functioning? So in 2003, at least half the doctors would say 80% of the time the equipment was functioning or usually available, usually functioning. And that dropped substantially. 2007, numbers fairly small, but it looked like things were maybe picking up a bit then. Essential drugs. What did the facility have for essential drugs? So 2003, people were fairly comfortable with the amount of drugs that were present. Dropped off again dramatically in 2006, and then rose a bit after that. We ask about the percent of the workload that was due to violent injuries in your health facility, whether it was your hospital or your outpatient clinic and so forth. So early on, about half of the facilities, half the doctors would say, well, about 40% in 2003 were related to violent injuries. And by 2006, that was over 80%, reported by half of the doctors. Then one of the questions that had come about from some of the formative work is that a lot of junior people were doing work that more experienced doctors traditionally had done, and that seems to be reflected in this curve here. The complex procedures carried out by inexperienced doctors seem to peak again in 2006. So future plans. We asked people, what are you doing for the future? What are your plans? Well, majority of doctors said, we're not going back to Iraq. They had either decided they were already applying for resettlement someplace, or they were seriously considering it. 18% wanted to stay in Jordan, had some connections. These were often the older doctors who already had work permits and connections and so forth. And then people who had troubles in Jordan. If you got into difficulties with immigration and so forth, then he started thinking, maybe I will go back to Iraq. And there were a number of incentives at this time, and we asked doctors, how about these various cash incentives, securities incentives, and so forth? Does this persuade you to go back? And it seemed to have no effect whatsoever. And it's just kind of a final thing here, to show the strength of the pull. We had 6 young Iraqi doctors as our interviewers, and these kids were really good. They were graduates the last couple of years. All of them are gone from Jordan. They're all in Texas, I think, right now, doing their further education. And I'm sure if the same numbers go to Canada and to Australia and the UK, they're really enriching that health system. These young doctors are really good. They're superb. So in Iraq, we could say that the conflict seems to be responsible for a substantial loss in human capital, from the tertiary level down to the junior levels. Violent events are commonly experienced by doctors. Many stories related to being kidnapped, ransom usually starts around $110,000 US dollars, and settlements are someplace between $40,000 and $60,000. And increasingly, even if the families pay, the doctor is still killed. So there's those risks. Perceived quality, everybody felt the system was deteriorating. Of course, we have a very selected population. Bed occupancy remained high, although that is now more and more in trauma cases. Replacing the human capital is going to be a major challenge for the health system, a huge issue because a lot of the faculty have left from various places. And from the Afghanistan side, there's been a steady improvement in many health indicators, although, and I didn't show you some of them here, some of them are pretty low levels, and it means there's a long way to go yet to improve services there. So, that's it. Okay.